Hello and welcome to Wimpole Street Dental Clinic. My name is Christian Mill, and in the following video we would like to show you how we do bone augmentations. Bone augmentations can be a very integral part of implant placements and or pre-prosthodontic treatment. So thank you very much for your time, and we really hope that you enjoy the video. Thank you.
You can see here the initial situation of the patient with an upper and lower so-called cover denture, and the cover denture was supported by golden telescopic crowns, which you see here in that picture, and the patient was very unsatisfied and unhappy with the teeth, and her main wish was to bite an apple again and really have fixed teeth again. If you have a look at the average vertical length of root here seen on the blue arrow, is roughly around 10 millimeters. If you deduct 2 to 3 millimeters for the soft tissue, for the gums, then you roughly can say what the bone height or length will be. If you have a look at the horizontal dimension, you can do exactly the same thing. You can see here the blue arrows again indicating the horizontal width of the bone and the soft tissue. But if you open it up, you can see again the blue arrows indicating the residual bone, the yellow arrows indicating the soft tissue. And you can see the bone shrinks significantly with regard to the horizontal width. So if you want to place an implant in this size of the bone, it is very likely that the threads of the implants will be visible on the inside and on the outside of the bone. And that's not the goal we have. The implant has to be covered by bone all around. So if you, for example, place a 4 millimeter implant, you have roughly 1 to 1.5 millimeter residual implant surface left, which is not covered by the bone. So what we need to do is we need to have a bone augmentation or bone graft. And what you can see here is the yellow arrows again indicating the soft tissue of the palate, the blue arrow indicating artificial bone, in that case from the femur bone of a cow. So the bone is of bovine origin, and the green arrow indicates a membrane which is covering the artificial bone so that no soft tissue can grow into that, no gum tissue can grow into where we would like to have bone later on. So if you place an implant now, you can clearly see that we will have enough width of the bone later on so that the implant is covered by bone all around. The bone augmentation, the bone graft, has to stay there for roughly 4 months and should be not too much be chewed on, that because the quiet and the peace of the tissue to be grown is of vital importance. Because if you use it too much, then the vital blood supply will vanish, and then you have soft tissue instead of new bone. So you can see that here the membrane just goes to the palatal side, and you then stitch back together the wound very tightly so that no bacteria and other things can infiltrate our wound. And then again, best is not to wear the denture for 1 or 2 weeks. And then after 4 months, you can place the implants. And then 3 months after that, you can take the impression. You can see here the situation 7 months later. So 4 months for the bone augmentation and 3 months for letting the implants heal. And then this is the final work for the patient. So bone grafts can help us to fix teeth again with the help of implants. Thank you very much for your kind attention.